Dysphagia is when a person has trouble with swallowing, which can lead to choking, dehydration, and lung infections like aspiration pneumonia. It involves many muscles and nerves working together. The causes include neurological issues like stroke or Parkinson's, physical changes like cancer, surgery, or aging and medications, or poor oral health. When you are looking for signs of dysphagia, look for obvious signs such as coughing, choking, food leaking, wet voice. Also look for subtle signs such as taking a long time to eat, holding food in the mouth, sudden tiredness, and repeated chest infections. Silent aspiration is particularly dangerous because there are no clear signs. This is when you will need to watch for chest infections, fatigue, or wet breathing sounds later. It's important to always document what you see and escalate serious or worsening signs to a supervisor or clinical team. Infection control and hygiene are paramount, and clean hands are critical. Wash your hands thoroughly with soap before and after food tasks. Use gloves properly, but remember that they don't replace hand washing. Prepare and store food safely, preventing contamination. Clean and disinfect feeding equipment before and after each use. These practices protect everyone from infection, which is especially important for people with dysphagia. Follow the swallowing care plan exactly. It will tell you what textures and fluid thicknesses to use. These are the HIDPA levels. How to position the participant and what signs to watch for and what to do. Your role will be to set up meals safely, use the right equipment, supervise as needed, communicate clearly, and document everything. Don't change the plan yourself or try new foods, instead escalate concerns. Changing plans is the domain of speech pathologists who assess swallowing, dietitians, nurses, OTs, and doctors. Clear, calm communication keeps meals safe and dignified. Use simple language and check how the participant feels. Watch for nonverbal signs such as grimacing, turning away, and a wet voice. AAC devices like symbol boards should be available and working if used. Create a calm environment, avoiding noise and chaos. Document any communication issues or changes. Remember that the right tools make swallowing easier, using special cutlery like angled spoons or plate guards. Providing thickened fluids, check care plan and HIDPA levels, never guess. Use supportive seating which is upright, with footrests or cushions as needed. Clean all equipment properly and check for damage. Follow the HIDPA framework to choose the correct food and drink thickness. Levels 0 to 7 cover everything from thin liquids to soft or minced foods. Testing methods like the flow test, and fork pressure test help confirm correct textures. Never change textures yourself, always follow the plan. A calm, safe environment will help with swallowing and reduce noise and distractions. Respect participant preferences. Offer choices and involve them in decisions. Avoid talking over them, as they should always feel part of the conversation. Choking and aspiration are life-threatening. It's imperative that you act fast. You need to follow your employer's requirements, which may include: stop feeding immediately, encourage the person to cough, and call 000. If the person is unresponsive, then start CPR. Never put your fingers in their mouth. Remember to always document and report it.